Hi, thank you everybody for joining today. We're really excited to have this webinar and to sort of share some of what we know and are doing in the time of COVID-19, particularly with regard to the multidisciplinary ALS Care Center at the MGH Healy Center for ALS. I'm James Berry, I'm the clinic director. We have a really, I think, exciting slide deck today to sort of share some of the things that we think will be helpful to you. I'll give a brief introduction, and that will be followed by presentations from our physical therapist, speech therapist, social worker, neuropalliative care and symptom-based neurology, parenting at a challenging time team, and we'll end with some discussion of research. And then at the end, we'll have time for questions and answers. And for questions and answers, we can either unmute people to ask a question, or there is a question, a box to type in questions, and we'll be reading those questions and have the panelists answer them. If we're not able to get to all the questions today, we will follow up with questions after this webinar, and the webinar will be posted to our website afterwards. So thank you very much for joining. Next slide. Perhaps the most important point today that we want to get across is that we are a community and we continue to be a community. So in the face of the COVID-19 outbreak, just as always, we want to be here to support you, and we want you to be in touch if you need us, or if you're not sure that you need us, if you have a question we might be helpful with. There are three important ways to get in touch with us. One is through Patient Gateway, which is a communication system through our medical records. It helps us stay connected as a team on our end, so it's a nice way for you to reach out to us so that the whole team can be connected. You can also call the office, 617-724-3914. And finally, if you have an urgent matter, you can page any of us by calling the main MGH number, 617-726-2000, and just ask for your physician to be paged. If for some reason one of us couldn't answer pages, we have a way of covering, having our pager covered by a colleague, so you would reach one of us that way. Next slide. So just a few basics about the coronavirus. The formal name of the novel coronavirus is SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus 2. The first SARS coronavirus emerged in the early 2000s. This is sort of the second in that same family. COVID-19 is the name for the illness that's caused by this novel coronavirus, and it stands for Coronavirus Disease of 2019. We hear a lot about the coronavirus test, and generally what people are talking about with this test is a test that detects viral RNA in the blood. And RNA is a lot like DNA. What this means is that we're detecting the actual virus in someone's bloodstream, and that means they have an active infection and are maybe ill themselves, but also are infectious or potentially could spread the disease. That's been the focus of testing thus far. We're beginning to hear talk about the coronavirus antibody test, which is a test that detects our own body's antibodies to the SARS-CoV-2 virus. Antibodies are the way that we fight this off. So this test doesn't tell us about an active infection. It tells us about a prior exposure or a previous infection, and may show people who have some immunity. There are questions about how long that immunity may last and whether it is complete immunity. Those are being worked out. But this test you'll hear more about over time. And the last definition is something we hear a lot about called PPE. That stands for personal protective equipment. And it means masks, gowns, gloves, potentially goggles, any of the things that we would use to prevent spread of the disease between people. Next slide. This is just a picture of what the SARS-CoV-2 virus looks like. There are really three parts to its structure: the envelope, which is shown in red, 4 structural proteins, which are in other colors in this, and the RNA, which is wound up in the middle of the virus. And the RNA is what tells the cell how to make more viruses. So this virus is not really alive, but when it docks onto a cell and sends its RNA into that cell, it makes the cell create more viruses until it sort of bursts with more viruses and they're spread around. A really important thing that we learned from the structure of this virus is that coating, that envelope in red, is made of a fatty material, and it's very susceptible to soap and water. So just simple soap and water inactivates this virus, and that's why we hear so much about hand washing being important in preventing spread of this. A very important tool. Next slide. So it's important to know what the symptoms of COVID-19 could be, and this is something that has evolved over time as we learned more about the virus. But within about 2 to 14 days after exposure, people experience some combination of fevers, chills, cough, shortness of breath, muscle pain or muscle aches, headache, sore throat. It was learned not so many weeks ago that there was a sort of a loss of taste or smell that can happen. And even GI upset can be a part of this, we're learning. It's also important to know that many people are asymptomatic when they are infected with the virus and can spread the disease without having symptoms themselves. Now, it's also important to know when to seek medical attention, and this is not an all-inclusive list, but if you're experiencing an increased difficulty in breathing that's troublesome, that's a warning sign to seek medical attention. And the same thing if people are having pain or pressure in the chest. If someone is seeming more confused or difficult to arouse, that would be a trigger to seek medical attention, and clearly bluish discoloration of the lips or the face. And the final one I would say is dehydration, either because people can't eat or drink or because they have a high fever. And that's another reason to seek medical attention. And it's important to seek that medical attention, and really hospitals have set up ways to see people safely who may or may not have COVID-19. Next slide. People with ALS have special COVID prevention needs. And one of the main reasons for this is that many people with ALS cannot avoid close contact with care providers. So the idea that we can simply isolate and not experience any connection with the outside world probably doesn't apply to people with ALS. When we go into this mode of sort of social distancing and close to isolation, close contacts within a household become closer than ever. And so when you invite a caregiver in, as many people with ALS have to, then you invite all of their close contacts closer than ever as well. And so it's really important that you feel comfortable talking with care providers about how you stay safe. And that means, your care provider should tell you about any symptoms that they have that may or may not be COVID-19 related, and exposures that they may have. It's also important to ask them to wash hands when they enter your home and before and after touching you. It's a lot of hand washing, but that's an important key tool that we know from looking at the structure of this virus. Wearing a mask and gloves for personal care, if possible, is important. And cleaning and disinfecting frequently touched surfaces and equipment. So everything from doorknobs to countertops to some of the equipment that may be used for personal care. Next slide. There have been changes in home care services. Some home care providers have closed or scaled back. So that's important to know, but there may be other ones that are still open and some that are providing online resources. For the ones that are still open, if you haven't established care, it's good to plan ahead. Waiting times have gone up some. So we used to be able to get home care providers in within a couple of days. It sometimes is taking longer than that. So better to think about it ahead of time if you need to establish new care. Some people with ALS have opted to discontinue home services or to minimize home services to minimize their contacts. And I think that's a very reasonable approach to this. Just important to know what your needs are at home. And it's also important to know that home care organizations are using PPE for safety. So they have their own protocols in place to make sure that, that their staff are safe and also the people that they're caring for are safe. If you have questions about this, As many of you have, please reach out to us. We're happy to talk with you about this for your specific situation. Next slide. So just by way of staying prepared, it's best to have a plan in case you or a caregiver gets sick. That may include having a contact list of friends, family, neighbors, talking to them ahead of time about how you might reach out to them if you or a caregiver were to get sick. Good to have those backup plans if possible ahead of time. Plan at least 2 ways of communicating. So it's not just a cell phone, it's not just verbal communication. It may be that when you're communicating with somebody who you're not as familiar with, you need to be very clear about what is a backup way of communicating, particularly if you have any difficulty speaking or making yourself understood. If you can have a 30-day supply of medications and supplies, that's ideal. Make a photocopy of prescriptions, or at least write down what your medications are. And we should all be assigning a healthcare proxy. In Massachusetts, you can Google Massachusetts HCP form, that stands for healthcare proxy. And one of the top 2 hits will be the healthcare proxy form. And really everybody should be filling these out. If you're in another state, there are state-specific forms, but they're not hard to find online. Next slide. So we've done a lot of work to reposition the ALS clinic for COVID-19. All possible visits have been converted to video televisits or telephone, and we're continuing to do that for upcoming visits. Multidisciplinary care is being conducted as follow-up visits by phone or video after you've met with the physician or the nurse practitioner that you're meeting with. And that would include physical therapy, speech therapy, respiratory, social work, et cetera, et cetera. In many cases, we're using local laboratories close to home for necessary blood work. So we're mailing out a prescription for blood work rather than bringing people to Massachusetts General Hospital. We've switched to ordering wheelchairs and BiPAP and suction and cough assist based on televisits, something that wasn't possible before the COVID-19 outbreak. And wheelchair evaluations can even be done virtually if you have a home physical therapist who can come in and do that with you. And then have the wheelchair clinic on the other end of a virtual visit. We've changed our approach to feeding tube or G-tube placement. We're doing the pre-procedure visits via telehealth, and we're also having people return home the same day if at all possible. For now, we're focusing on more urgent feeding tubes, but this is changing, and it's really important. If this is in any of your thinking at all, it's important to talk with the team so that we can get that timing right. And we're doing in-person visits really only as truly needed at present. We've paused the ALS house call program again at present, and we're doing those follow-ups by virtual and telephone call, although these things are constantly evolving. Next slide. So now we're working on repositioning the ALS clinic really for the long term with COVID-19. The likelihood is that this virus is not going away next week, next month, or even within the next few months. And so we're already looking at options for how do we see new patients, for example. And what's a safe way to bring them in. And we know that we can do this safely, but we need to lay the plans very carefully. We were just having a conversation about how to reopen our house call program as well. We will likely ease into reopening. It will not probably be just flipping a switch and going back to how it was, because we're going to do this very, very carefully. At Mass General Hospital, we've now created a COVID positive clinic where we can see people for routine care, for ALS care, for primary care, whatever care they need, even if they are positive for COVID-19 at the time. And that means we can treat COVID positive patients effectively, and we can also reduce spread of COVID in our clinics. We will have all the PPE and procedures in place that we need to treat people safely by the time we do this. And I really want to stress that we're doing this with caution so that we can treat people safely and effectively when we do reopen. We will be able to do this. We're laying the plans to do this. We have a huge amount of expertise in place to do this. Next slide. Just a listing of additional resources. These are wonderful organizations that support our work both in clinic and research, as well as people with ALS locally and nationally. ALS One and Compassionate Care ALS are really wonderful organizations that are based here in Massachusetts. And we also have very strong presence of national organizations here within our clinic, and these have been resources to many people in our clinic. Muscular Dystrophy Association, ALS Association, Patient Advocacy Organization, IMALS, and the the NEALS Clinical Trial Network. There is good information about ALS and in most cases about COVID and ALS on each of these websites. With next slide. With that, I'm gonna pass off to Amy Elrod, who will talk about physical therapy in our clinic.
Hello, I'm Amy Elrod. I'm one of the physical therapists in the ALS clinic at Mass General, and we just wanted to give you some resources as things are changing because of COVID. And things are changing daily, so we're just trying to keep up. Next slide, please. So during quarantine, most PT visits, outpatient, including the ALS clinic, have gone virtual or remote. So that means that most outpatient physical therapy clinics have closed or are only doing virtual or telephone follow-up visits. Our ALS clinic visits have gone entirely remote. Our clinic PTs, myself and Katie Burke, are available every day by phone, by Patient Gateway, which is our secure Epic system. So if you have questions, please reach out. We're here, we're working, we're just working from home most of the time, but we're doing a lot of follow-up for people by phone. So some outpatient PT and OT practices are doing virtual visits. Mass General, for one, has a certain amount of bandwidth to do virtual visits if that's something you'd be interested in for ongoing care. This changes daily as people are being redeployed for COVID, but certainly if you're someone that sees PT or OT at Mass General or at one of the local clinics here, let us know. We can work with them, or you can always call your local PT facility to find out what resources they have for remote PT. As Dr. Berry mentioned, some home care agencies are closed, but some are still providing home PT with additional safety measures in place for COVID. So let us know if you have a specific need for home PT, and we can certainly explore what's available in your area. And there are a lot of online resources. I know patients have reached out because they have questions about stretching or exercise, and there's a lot of good online resources, and we can help direct you to those as well. For stretching, for exercises, for transfers, for mobility. YouTube can be a good resource for gentle stretching exercises. There's a whole world of gentle yoga and seated yoga, which is a lot of stretching and gentle exercise. If you use those keywords, and you can sort of look at them and choose what works best for you. You know, as with anything else, you have to be careful of what you read on the internet, and approach the resources with caution and common sense. But there are, particularly right now when all the gyms and yoga studios are closed, there's a lot of free online resources for videos that you can follow along with. Next slide. So in general, in terms of exercise, this is very different for each person. It has to do with your baseline level of fitness. It has to do with how much and where you might have weakness due to ALS. But the same principles stand that we always tell you about exercise. So exercise can be particularly helpful to prevent joint stiffness and maintain range of motion. Stretching sometimes can go a long way to prevent pain in your joints and stiffness. Exercise can keep your healthy muscles strong. If you're doing exercise in strong muscles, it can help to maintain that muscle strength, and that in turn helps to maintain your independence and your function. There's emotional benefits to exercise. Even some of the studies that don't show a statistically significant change in the course of muscle weakness in ALS showed a statistically significant difference in quality of life. The patients that exercise had a higher quality of life than the patients that did not. So things you can do at home. It's a little different when you're at home and you're not able to go to the gym, or you're not able to go to physical therapy, or you're not able to go to yoga. Stretching, you can definitely do stretching at home, and stretching is almost universally beneficial. Active range of motion, which is movement similar to stretching but without weights. If you're able to walk, you can walk around your house. We were actually talking this week, some road races and walks are doing virtual versions, and people are actually getting miles and miles just walking around their house. Stationary bicycle is also a great option if you have one of those at home. It's a good combination of a good cardiovascular exercise and some moderate weight resistance exercise for your legs, where you can also stop anytime and you're at very low risk for falling. Just be very careful getting on and off the bike. And then if you need help with movement, you can do assisted range of motion, you can do assisted stretching at home as well. So the do's and don'ts: take rest breaks throughout the day. Don't push it until you're exhausted. You know, make sure that you're saving enough energy for your necessary daily activities and the things you want to do. You know, if you like to go outside for a walk around the block every day just to get some, well, not today, but some sunshine on the nice days, you know, don't exercise so much in the morning that you're not able to do that. Make sure you're recovering from your exercise within 30 to 60 minutes, what that means is it's okay to feel tired when you're done, muscle tired and just overall tired, but if you rest for 30 to 60 minutes, you should feel like you could do that exercise again. Don't exercise to the point of fatigue. Don't exercise entirely to fatigue, all over fatigue, and don't exercise a single muscle to fatigue. That just isn't helpful to these muscles that are struggling to heal. Don't feel the burn, so don't exercise until your muscles are burning. And don't exercise until your muscles are sore the next day. It's just harder for people with ALS to heal that muscle soreness. And so we always say just try to avoid the muscle soreness if possible. Focus on exercising the stronger muscles. The stronger muscles are healthy and they can withstand some exercise, and it does seem that moderate exercise in the stronger muscles is beneficial. The muscles that are weak are working so hard to perform your daily activities that it doesn't seem that additional exercise in those muscles is very useful. And then just making sure, particularly in the time where you want to avoid any unnecessary trips to the emergency room, certainly go if you need to go, but we want to avoid injuries. So just making sure you're choosing things that are safe, that aren't going to cause you to fall or injure yourself. Next slide, please. So two things we wanted to really focus on are the importance of maintaining range of motion, and daily stretching, either by yourself or with a caregiver helping, can really help to keep your limbs mobile, avoid pain, keep you moving, make sleep better, positioning easier. So Katie Burke, our other PT, made 2 videos for stretching. And one you can follow along with is with a caregiver doing the stretching, so passive stretching. And then the second video is seated stretching that you can do on your own. And these videos are great because you can actually watch them every day and just follow along with Katie as she's doing the stretches. The NEALS website also has great online resources for stretching. The links are here, and we're also going to send the links out for those of you who won't have access to the slides. We're going to send the links out in an email blast after this webinar so everyone has access to the links. And then the last thing is just importance of maintaining safety. Like I said, you don't want to do exercises that are going to be high risk for falls. Trying to avoid injuries that, you know, you just don't want to cause yourself any injuries or pain or stiffness. And you also want to make sure that your caregivers stay safe and that they stay healthy. So 2 things that can really help with that is utilizing any and all equipment that's available to you, even if you don't really need it yet. I know a lot of patients are very proactive about getting equipment for mobility, for transfers, for daily activities, and then they, you know, hold on to it until they feel like they really need it, which is fine. But in these days when we're really trying to focus on safety and keeping everyone safe and healthy at home, it may make sense just to utilize that equipment maybe earlier than you normally would. And then you can always go back to not using it if you don't feel like you need it. And then any equipment that we're ordering, and examples are hospital beds, you know, commodes, Hoyer lifts, things like that. Please let us know as soon as possible if you're considering ordering one of those, because there are some potential delays in delivery. We've had a lot of inconsistency in delivery. Some companies, if they have something in stock and it's not that busy, they can deliver it the next day. Some companies are having problems with supply chain, so they're having problems getting the equipment. And then they're also having staffing issues where most people are working remote and there aren't very many people in the warehouse and there aren't very many people doing delivery. So it can just take a little bit longer to get things. So please get in touch with us. Let us know if you have any questions, if there's anything we can help with. If we can help you set up equipment or services at home. We just want you to know that we're still here to help and to try to help everyone make things as easy as possible for all of you during this time. Next slide, please. And with that, I'm going to pass it on to Stacy Sullivan.
Hello, my name's Stacy Sullivan, and I work together with Paige Nalapinski in the clinic as a speech pathologist to help patients navigate speech and swallowing changes over the course of the disease. Wanted to take this opportunity today to go over some resources available and things you can do at home when you are not able to come in for an in-person clinic visit. And to start out and echo what Amy was saying, we are available for you. We are providing care virtually over video and also over the phone, and happy to help you navigate through any speech and swallowing related things that you need support with. So some people may be very well versed and know Paige and I really well, and some people aren't sure if they haven't experienced any speech and swallowing changes as a part of their symptoms. So I wanted to kind of review what to look for so that you know if you are experiencing new subtle things, where we can go with that. So excuse me, speech and swallowing changes can be subtle or they can come on really quickly, and they can also progress really slowly or very quickly. Treatment of speech and swallowing changes in persons with ALS focuses on supportive care. So one of the first things that usually comes up when I meet patients in the clinic is they will ask about exercise. So they want to know what to do to either try to rehabilitate or maintain function if they're noticing changes to their lips, mouth, tongue, etc. These exercises are actually not indicated in these small muscle groups. As Amy had referenced, function is a lot of work for these muscles already. We swallow 600 to 900 times a day, including saliva and eating food, and then of course talking. So these little muscles are moving all the time, and we don't want to increase that workload. So to avoid increasing fatigue and decreasing function. So we actually do not recommend that you exercise anything about your speech and swallowing muscles. That being said, if you are looking around on the internet, you will likely find some recommendations that are different than that. There are some areas of research that suggest that certain very specific patient populations are appropriate for new types of exercise treatments. And so I want to encourage you, if you are running into something like that on the internet and you're wondering if something like that may be appropriate or right for you, please reach out and we are absolutely happy to have a discussion with you about it and make sure that you're accessing all the treatments that would be the most appropriate for you. Another important thing to mention in terms of swallowing changes is that early and ongoing identification and management of swallowing is always important, but particularly important now in the setting of the COVID crisis, because we really want to work as hard as possible to prevent unplanned hospitalizations. And if you are having things go down the wrong way and you're having pulmonary side effects as a result of that, or you're struggling with nutrition or dehydration, those can be things that significantly impact your overall health. And we want to work hard to address those changes to make sure that we can keep you healthy and safe at home and not have to go in for something that was not planned. Next slide, please. Sometimes swallowing changes are obvious. So if you are coughing or choking while you're eating, then clearly, that's not going very well. And so you would likely discuss that with your physician or your nurse or someone on your care team, and then be encouraged to go ahead and meet with Paige or I. But sometimes it's a little more subtle. And so I wanted to put some things on your radar that you may not be thinking of as a change to speech and swallowing, or swallowing specifically. So prolonged meal length and things like food sticking in the spaces in between your lips and your teeth, or coating on the roof of your mouth, can be signs that you're beginning to experience changes to your tongue muscle, and would be a reason to start having a conversation with speech therapy from the clinic. Things like prolonged meal length, difficulty with self-feeding, or because of changes to your arm function, or also breathing. When we swallow, you have to hold your breath every time you swallow. And so if you're already struggling with endurance around breathing, then eating a meal can be very fatiguing for you, because you have to keep holding your breath to swallow. And so these are sort of subtle changes that result in, you know, maybe you're eating 10 bites less per meal or every time you sit down to something, and those 10 bites are really going to add up, and they can result in progressive and unintentional weight loss. You have likely heard during your meetings with your teams, everybody asks you how much you weigh, and we're always talking about don't lose any weight, and maintaining maximum nutrition is very protective for managing symptoms of the disease in various ways. And so changes to your swallowing directly impact your ability to get that adequate nutrition. And so it's a very important thing to have on your radar. Treatment for swallowing is, again, supportive in nature and compensatory. We will help you explore diet modifications, focus on efficiency, drinking smoothies or protein shakes or liquid nutrition supplements such as Ensure are great ways to get lots of calories and good nutrition without a lot of effort. So you're not, you know, we can't say, okay, you need to eat more. You're not going to all of a sudden be able to eat 5 sandwiches. We have to find other ways to make it really efficient and effective for you. Some of the things that we look at when we're looking at changes to swallowing, not directly related to swallowing, but we want to think about secretion management, airway clearance. Should you be using a cough assist? How frequently would that be helpful for you? Oral care is extraordinarily important and can become increasingly difficult, again, with changes to the muscles of the mouth and the face, but also changes to upper extremity use. And so those are things that we want to explore with you and make sure that you are able to do effectively, as independently as possible. And if it's not working, we want to come up with a creative plan. Some patients, depending on the severity of nutrition, breathing, and swallowing function, will opt to have a feeding tube as a part of their overall care plan. And that's something that involves a lot of discussions and is a part of something you may talk about with the speech therapist as well. And there are special considerations for that now in the COVID crisis, which Dr. Berry referenced in the beginning. But if that's something that's applicable to you, then I'm happy to discuss further, of course. Next slide, please. The other sort of main piece that working with a speech pathologist is useful for is to address communication. So for various reasons, including changes to breathing and changes to the mouth and tongue muscles, you may experience difficulty speaking. Some patients think about voice and message banking. If either before changes to speech occur or in the early stages of speech changes, they opt to record their speech in the hopes of using it with technology down the road should their speech changes become significant enough where they have to find another way to communicate. So energy conservation techniques are extremely useful in maximizing speech function over the course of a day. Compensatory strategies, environmental modifications, making sure you are in a well-lit environment without background noise, using FaceTime instead of trying to make a phone call so people can use all of the cues that we have on our face to understand messaging. with verbal speech. There's lots of strategies that can help people navigate these changes to their speech and make the situation the least amount of frustrating as possible for both the person affected, but also for the people that they're communicating with. There are a lot of types of technology that we use to augment function when patients are having changes to these speech and swallowing. Voice amplification can be extremely useful to improve vocal volume, but also facilitate energy conservation for patients that are, having changes to their breathing and speaking. You're always pushing so hard. Wearing a voice amplifier can really take a lot of pressure off there and help you maintain function over the course of the day. Text-to-speech applications, if people are having a hard time understanding you, we introduce that stuff early on to give you another way to say your message. And then higher tech communication options such as eye gaze systems, etc. We work closely with the group at Boston Children's Hospital to help our patients access the appropriate technology that they need. They have speech therapy and occupational therapists that specialize in augmentative technology and can help fit you with the most appropriate things, a mouse that you control with a head pointer and all sorts of amazing things. So they have a great website. I put the link down on the bottom. So if you're wondering, saying, I've never heard of this stuff before, they have videos and some examples of some of the types of technology that people are using and some nice handouts for patients and caregivers. So I encourage you to check out that website. If these are things that you, any of the voice and message banking or anything like that is something that you are interested in or want to learn more, again, just let anyone on your care team know, and Paige or I can reach out to you to figure out if that moving forward with that would be a good fit. And these are things that can be accessed virtually at this time. So your ability to do these things as a part of your care plan is not affected by the kind of stay-at-home restrictions that we're all experiencing. Next slide, please. So finally, what to do. Again, just to summarize, we're here for you. There's things that you can do in your home with the stuff that you already have that can really maximize your nutrition and your swallowing safety and your ability to maximize your communication and feel very supported in those ways. Talk to the team about any changes that you notice. They will connect you with Paige or myself, and we will reach out to you virtually to plan action. There are some limitations in accessibility of home care, outpatient and video swallow studies, and especially depending on where you live, but we will help you problem solve what you need and how to get it in this stay-at-home time. We are closely connected with organizations such as ALSA and CCALS to get loaner devices if appropriate. If we need technology that you need to try or can't access because of restrictions, then we'll try to help you find it in creative ways. And then of course the referral to Boston Children's. So thank you so much. Next slide.
All right, thanks so much, Stacy. My name is Kate Brizzi, and I do supportive neurology and neuropalliative care. I'm going to be discussing other ways you can protect your health with important conversations. Next slide. So as we've been discussing, there are a number of practical steps that you can take to help protect your health. And one of these is to have proactive conversations with loved ones or caregivers. We recommend that everyone have a healthcare proxy. That means both PALs and caregivers. And so what is a healthcare proxy? A healthcare proxy is a person that you designate to make medical decisions for you if you were to become sick and would be unable to speak for yourself. If you've never formally designated someone a healthcare proxy before, there are links online, as Dr. Berry was mentioning earlier, that you can you can download forms to kind of complete at home. I have an example of one of them kind of posted here that you can take a look at. It's very important that your healthcare proxy has a good understanding of your values as it relates to your health. And so we recommend that you discuss your goals and priorities with your proxy and with loved ones. There are many different guides that are freely available online to help think about how to frame these discussions. I have one example of a guide that is available up here on the link shown. These conversations can sometimes be hard, but research has actually shown that many people actually feel better and have less anxiety after discussing their priorities. There are formal documents that you can complete with a provider related to these conversations. Many people may have heard of a form called a MOLST or a POST, sort of depending on what state you live in. These are formal documents that you can complete together with a provider, including us in your ALS team, and they can actually be done over televisits as well. I want to emphasize that we are here to support you and we can help. If you'd like to discuss any more of this in any more detail, please reach out to us. And we're also happy to help facilitate these discussions if you would like. Just reach out to our clinic. Next slide. And with that, I'll pass it over for a discussion about additional resources.
Hey there, I'm Victoria. I'm the resource specialist with the clinic, and I'm going to go over some general resources that are available during COVID. Next slide, please. So the first resource to go over is called the Good Neighbor Program. This is currently a new resource that's been made available in the greater Boston area as well as some other local areas as well. The Good Neighbor Program is a program that was put into place for individuals whom are immunocompromised, elderly. It's unsafe for them to leave their home in this time of crisis. And these individuals can call and get set up with what they can call a good neighbor. That person can help them with running errands such as getting connected to groceries, picking up prescriptions, things in the community that they might need access to that they don't have access to. In the greater Boston area, the number to call would be 877-958-8785 to get that set up, and someone can help you with those errands. Another option for individuals whom are having difficulties with prescription is the HealthWell Foundation. This is a foundation for people whom are having difficulty paying for their prescriptions, the cost of medications for ALS. I apologize. You can apply for a grant. The grant lasts for about a year, and then individuals can reapply for it. This is available all the time, not just during COVID, and it helps with covering the cost of prescriptions. For example, Riluzole, Nuedexta, Radicava, those sorts of things. Another resource is the Susie Foundation. They typically offer grants by twice a year, and patients can apply for those in the spring and fall. They've currently changed the way that they're allowing people to apply for grants. So now they have a flex grant that's available to anyone that's experiencing financial strain in regards to COVID, and they're offering a $500 grant to people that they can apply for. They also have a Good Neighbor program that's set up in Connecticut. Next slide, please. There's also a couple different options for getting groceries at this time if you're not in a place that has a Good Neighbor program. One of those options is Peapod. This is a grocery delivery service that's set up through Stop and Shop. You can, online, on an app on your phone, using a computer, you can place an order for groceries. You pick what you want, somebody goes and gets those groceries for you, they deliver them to your door through contactless delivery. You can also get groceries through Whole Foods if you have access to Amazon Prime. It works the same way. There's also a phone app called Instacart. This is an app where you pick the grocery store you'd like to shop at. You go through your grocery shopping, pick whatever you'd like. Someone goes and picks up those groceries and delivers them to you. There can be some delay in the delivery time for these things. It depends on what's available in your store and what's available locally for drivers to deliver. On top of that, many grocery stores have amended hours for people who are over 65 or who have an immune compromise. You can call your local grocery store and find out what time those hours are. In addition to that, there's also some local food pantries that are helping a lot of individuals. They store food, they stack food, they have different hours, different times that people can come in. So if you have questions about those, you can Google your local food pantry, and you can call and get more information. Next slide, please. And lastly is United Way. This is a general resource. It's not specific to ALS, but it is available to anybody in Massachusetts. They have established what they call a family support fund for working families that have been affected by COVID. If you're having trouble covering the costs of rent, utilities, food, etc., you are able to access these funds. They are set up kind of across Massachusetts and throughout each individual town. If you have questions about accessing these funds, if you qualify for these funds, you can call 211. You can give them your area and you can ask about the Family Support Fund. Next slide, please. And with that, I'm going to pass it on to the TAC team. Thank you so much.
Hi, I'm Cindy Moore from the ALS Parenting at a Challenging Time program. My colleagues, Dr. Archana Basu, Paula Rausch, and I remain available to provide parent guidance consultations to you by telephone or virtual video visit. Our conversations are focused on thinking with parents about how to best support children's resilient coping as families cope with changes in a parent or grandparent that come along with ALS, and now also on how COVID-19 is affecting family life. Next slide, please. We're hearing from families about the impacts of the effects of physical distancing between different households and sometimes inside one house to protect each other, and sort of the impact on practical and emotional support. We know there's increased caregiving stress and parenting stress for sure, as parents have to have children home many more hours of the day than they're used to. And there's direct impact on children of all of this too. Some children are having to take on new responsibilities. They certainly have their own concerns about COVID and the impact on the family. And children are experiencing their own losses and stressors too, as they're adjusting to not having access to friends in the same way, disappointments about opportunities that are going to be missed in the school year. Next slide, please. So we're really focused first on encouraging people to support yourselves along with your children, and really the importance of starting with ourselves here. It's not a selfish thing, it's sort of a survival thing, frankly. Right now, more than ever, self-care and self-compassion are so important. The demands on parents and caregivers are really tremendous. So every little bit you do for yourself is important. Effective coping and building resilience requires routine refueling. And when so much is out of our control, our feelings of not doing enough or not being enough in any one of our roles can really trigger thoughts of inadequacy. So it helps to find ways to talk back to those negative self-judgments, the way you might do for a good friend that you're trying to encourage. With children, one thing that helps is to express gratitude to them for the things that they're helping out with, even simply taking better care of themselves than usual. Some families will set a goal of trying to find 5 things every day to compliment every other family member about, and just trying to tick off in our minds, okay, 1, 2, 3, 4, 5 helps keep that front and center, because it's easy to forget to notice the good. We try to encourage families to ask questions of children and engage children in conversations. Children, and even including teenagers, really need adults to help process COVID-related information and its implications for you and your family. So for example, what's happening to your medical appointments, and will the home health aid continue? Maybe questions that children have and maybe verbalizing or not. So try to look for ways to try to create opportunities to explore their questions and concerns. Also being aware that there are probably differences in how each family member is experiencing the changes and losses that are part of our new lifestyle. It helps to really ask about and acknowledge and validate each person's experience. And there's no easy way to manage a lot of the competing demands placed on you as a family. Sometimes acknowledging that things won't be even close to perfect, and some days may feel really crummy. Next slide. And so that leads into the value of readjusting expectations and priorities, both for yourself and for your children. So for example, crisis schooling, not homeschooling, might mean new academic goals. For some children, maintaining the same goals is really an important in a healthy way of coping, maybe because they're facing crucial academic milestones, but most kids will not engage in the same amount of independent learning that they would have otherwise at school. So try to focus on what needs to get done today, tomorrow, maybe this week. And amidst all the changes, remind children of good things that are the same as before. So looking for realistic reassurance. So even though I can't see my ALS team right now, they know how I'm doing. They'll help me decide on the best ways to take care of myself right now. I hope that that is coming across loud and clear in today's webinar. Talk about how as a family you're doing what you can. In fact, you have more experience than most in adapting to changes. And we're still connected to people who love us via phone and FaceTime, even if not physically together. And lastly, identify and focus on what you can control. So physical distancing, prevention, hygiene, those are all ways we take care of ourselves and each other. Provide children with choices as much as you can. There will always be chores, but which chores does who do and when do they do it? And then finally, you know your children and family best. We hear a lot about the importance of routine. I think it's also important to balance that with flexibility. Routines will look different for everybody, and you'll find the ones that work for you. So thank you, and I'm going to turn it over now, next slide, to Dr. Paganoni.
Thank you very much. It's a pleasure to be here, and my name is Sabrina Paganoni. I am an ALS physician and investigator, and I work with Dr. Barry, Dr. Sukovic, and our entire team at the Healy Center for ALS at Mass General. We're working on many different research programs, and I want to tell you now what we are doing to move our ALS research forward. Next slide, please. So the main message is that ALS research is a priority for us. And it is because we know how important this research is for people with ALS and their families. So here is what we're doing to keep it moving forward. So we continue to manage ongoing studies, and we changed visits to virtual or remote as much as possible. That means by phone or by video conferencing. And we have 7 trials that are ongoing, and a few expanded access programs. They are continuing again with a mix of in-person visits when needed and remote or virtual visits. We are also doing a lot of work in the background to prepare for when things will finally normalize. So we have 10 trials in startup. We are working on updating all our protocols and procedures for enrollment. We're finalizing startup for new trials. In other words, we are preparing to add more trials over the next few weeks and months. And we're also doing a lot of work in the background in terms of data collection remotely and also data analysis. And it's important to continue to analyze the data even from recent studies or previous studies so that we can continue the scientific conversation and continue to learn more about ALS. I also want to mention that we see new trends in funding research, and even more than ever, because COVID will have a financial impact, we need the help of the entire community to continue to fundraise and contribute so that we can continue to keep all our research programs open. Next slide, please. So let me tell you a little bit more about the impact of COVID-19 on our research. So in terms of observational trials, which are those trials where we are doing sort of discovery or biomarker research, many of them are essentially on pause unless they can be done remotely. So more than ever, remote protocols such as digital phenotyping, cell phone monitoring, those tools that can be used remotely, other than those, the other observational trials are essentially on pause because we are prioritizing drug trials. These are the trials where people with ALS can receive access to experimental treatments. And again, the focus is on doing required visits in person only when it's absolutely needed for treatment or safety. And all other visits are being done remotely by phone or video. Depending on the protocol, we can also at times get remote safety labs, which means people can continue to participate as long as they go and get safety labs at local resources, primary care physicians or local labs. And for most trials, with some exceptions, we cannot enroll new participants, although we expect this to change soon. And the bottom line is that there is a tremendous amount of work going on. So we are preparing new studies, adapting ongoing studies, and analyzing existing data. Next slide, please. And I want to take a minute to talk about the HEALY ALS platform trial. This is a highly anticipated trial, and I'm delighted to report that we have made a lot of progress, and we received approval from all regulatory bodies recently, including the FDA and the Central Ethics Board, also known as IRB. We also recently held our kickoff meeting, which is known as the investigator meeting, that was held remotely via video conferencing, but it was very successful with over 250 people gathering and learning about the platform trial and being trained on all aspects of the trial so that we can open up as soon as it's safe and feasible to do so. All sites are now working remotely. We are all working full time from home, and they are working on completing startup activities. And so at the same time, we're also trying to build in as much flexibility as possible into the protocol so that we can allow some visits to be remote. We have a task force that's actually looking right now as we speak at all the different options for building in flexibility so that as soon as we can start enrolling new participants, we can also have some options to allow some visits to be done remotely if needed in the geographic area of relevance. And so the idea now is, again, to work with all the sites so that they can complete all their startup activities and so that we can enroll at as many sites as possible once it's possible to do so. Normally, when we start a trial like this that's going to enroll in many different centers, we tend to activate or begin enrollment at different centers, sort of one at a time on a rolling basis. What we're doing now is to essentially make all sites as close to activation as possible so that when it's possible to start enrollment, they can start enrollment pretty much at most sites, if not all sites, at roughly the same time. And we're also committed to communicating all of this with the ALS community. We recorded a webinar a few days ago. It's posted on our website, and we will continue to update our website and post more information so that the ALS community knows when we're going to start enrollment. Next slide. I also want to mention that there are different online options for finding a trial center near you. So we will be enrolling at MGH, but also at other 50 plus sites across the country. So you can always find all the contact information for the site near you by going on clinicaltrials.gov. And the instructions are on this slide. And each center will be autonomous in its enrollment process. There's no cap of number of participants per center. So again, we hope to be able to open them up, at roughly the same time, over the next few weeks. And you can also find more information on our website. Next slide. And again, this is our contact information, and I want to turn it over to Dr. Barry now, who will lead the Q&A session.
Thanks so much, Sabrina. So I would say that we've had a number of questions come in throughout the presentation. I think we've actually touched on those questions so far. There were questions about the HEALY platform trial. There were questions about research, and there were a couple of questions about physical therapy. Each of them addressed, I think, already. Sabrina, there are a couple of questions that I might ask you to weigh in about that are very specific about sort of when the HEALY trial may start.
Sure. So essentially, we don't have an exact date because all the evolving federal and local regulations, continue to change. But we're paying close attention to that, and the goal is to essentially be ready to start as soon as it's possible to do so. There might be some geographic variability, so some sites will probably be allowed to start enrolling earlier than others. And again, we're basically working on this every day, all day, pretty much. And we will continue to communicate that over the next few weeks. I don't know if there was any specific question. You said there was more than one question about that.
So there were more than one question, but I think you answered them as well as we can answer them now. So there was another question, which is I think a really important question that came in about fundraising and contacts for that. So actually, first of all, we can certainly reach out to anybody who is interested in helping to raise funds. These are the lifeblood of how we do our work, both in clinic, where much of our multidisciplinary clinic is covered by philanthropy, as well as for clinical research, which is unfortunately too often covered by philanthropy as well. Certainly, you know, in addition to all the other resources for research. In order to give, if people are interested, there is also a website, www.massgeneral.org/ALS/support. And we can post that actually with this webinar when we post it on the web as well. If all else fails, you can Google Mass General ALS Clinic, and there are buttons to donate there as well, and designate you know, where you'd like that to go. There's another question, and again, we're over time, so I'll take a few minutes to just answer the questions that are here. If anybody has questions, go ahead and write them in. But I also understand if people have to go. There was a question about whether the NurOwn trial specifically has been impacted. I would say that you know, recently I read a report that was put out by one of the clinical research organizations that aggregated data from research from all kinds of trials, hundreds of trials, and showed that participation in trials was down 65 to 80% this year compared to the same time last year. So I think all trials have been affected. The NurOwn or Brainstorm trial was already fully enrolled by the time the COVID outbreak began, and like other ongoing important trials, is continuing to treat participants, but with some modifications to the design so that we can do it safely. So continuing to move through, and because it's already fully enrolled, minimal effect on timelines, we hope. Great question. I think that's all we have for now. If people have more questions, please feel free to reach out to providers. And thank you very much for participating. We're really happy to have this opportunity to connect. Be safe, be well.